My name is Jeff Matous. I'm a hematologist here and a member of the Colorado Blood Cancer Institute. People who come to see me have rare blood cancers. One of those is called multiple myeloma, one is called amyloidosis, and one is called Waldenstrom macroglobulinemia, and each of those diseases in order are less and less common. A lot of the patients that we see have already been seen by other hematologists and oncologists and have been referred either by their hematologist oncologist to come see me or have self-referred seeking special expertise for their particular blood problem. From medical school, all my role models were hematologists. It just worked out that way at the University of Washington. And I was attracted to blood right away. And then as an internal medicine resident, I was open to other specialties, but always knew that I would end up doing hematology. I want to take care of people who were sick, who had serious problems. That's why I went into medicine. And the reason I love hematology so much is because as a hematologist, we develop very deep, long-lasting relationships with our patients, much more so than in other specialties, and to me that's very attractive. The other reason is that the science in hematology is, generally speaking, way ahead of the science in other aspects of medicine. And in hematology, the bedside and the bench being the research aspect of medicine, are very, very close. And so the ability to take bench research and rapidly apply that to treat our patients with blood cancers always appealed to me. My passions are, believe it or not, languages. I'm a little bit of a linguist and like pursuing that. Anything sports. I was raised a Detroit Tiger fan initially till we got the Seattle Mariners in 1976 in Seattle. And now I'm a passionate Rockies fan and Rockies season ticket holder. And then I love doing out of doors things, in particular riding my bicycle. I'm passionate about the ability that I get to get up every morning and be a physician, and not just a physician, but a hematologist, and go to work and use tools that are amazing and improving by the day to help take care of my patients. My patients, they have serious problems. They have life-threatening conditions, and we need to find ways to make their lives better in any way that we can. And I'm so fortunate that in my field that more often than not, we can do that. I need to treat every patient as if they were a relative of mine, and to respect their dignity, and not just respect their dignity, but to know what their goals are. People have different goals with their lives, and when we're treating blood cancers, these are diseases that are usually fatal unless we fix them, that it's really important to know who the patient is, who are they at their core, what's important to them, and I need to understand that in order to provide the best consultation and care for that patient. I think being able to see our field move forward over the 35 years in which I've been a physician now, to see it go from what I'm sure the young docs think now was the dark ages, but to see all the scientific advances translate into meaningful benefits for patients. And so being able to sit across from a patient and have tough discussions, but come up with, hopefully, with plans and treatments that can provide them longer survivals with good quality of life. That's our goal. The best thing about Colorado Blood Cancer Institute is that we have a tremendous team that's at the top of their game from A to Z. What I mean from that is we have 10 physicians, soon to be 11 physicians, who are really, really good. And by good, I don't mean they're capable. You can't get in the door here and work here if you're not really smart and really capable. I mean, they're passionate, they're committed, they have a great way with patients. And then that's just where it starts. We have our advanced practice professionals, amazing people. I don't know what we would do without them. And then our nurses. And you go from our nurses to our front desk people, our schedulers, our coordinators, the people who clean the rooms, who feed the patients. Everyone here has the same vision and purpose in mind, that we are here to serve the patient. And by serve the patient, I mean respect their dignity and give them the best care possible.